Your little countdown will come up there. You see that there?
Good morning and welcome to this public briefing of the Standing Committee on Social Development. My name is Jane Way-Allen Armstrong. I am the MLA for Multi Country Region and chair of this Standing Committee. At this time, I will ask the members in attendance to introduce themselves.
Well, I think we're muted. Sorry.
Or is it just not muted? No.
Good morning. Good morning, George Nears through the MLA for the Mackenzie Delta.
Danny?
Good morning. My name is Danny McNeely, MLA for the SAW2. Welcome.
You know?
Test start here for Range Lake in Yellowknife.
Ms. Reed?
My name is Kate Reed. I'm the MLA for Great Slave here in Yellowknife.
Okay, good morning. I'm Shauna Morgan, MLA for Yellowknife North.
Hi, Julian Morse, MLA for Frame Lake in Yellowknife.
Robert? Okay, so we'll proceed. Okay, today committee will hear from Inclusion NWT regarding funding challenges. Since we are operating in an alternative space, I want to remind everyone to please wait to be called on by myself as chair before speaking. At this time, I would like to turn the floor over to our witnesses. Please introduce yourself and proceed with the presentation.
Thank you. I'm Ben Rousseau, President of Inclusion NWT.
I'm Janet Toner. I'm an independent consultant working with the organization.
Dennis McKenna, I'm a board member. Liv Foley, Inclusion NWT Executive Director.
Okay. With us online.
Inclusion NWT.
Proceed with your presentation.
Thank you. So we're going to go through why we're here today and who we are, the challenges we're facing. We've brought Janet Toner, of course. She provided us an independent report dealing with these very issues. And we'll conclude with our funding requests and any questions you might have. So the primary reason we're here today is stagnant funding. We have been dealing with contracts and contribution agreements that, despite being annual or despite having annual reporting requirements, they have not changed in numbers. We've been using numbers since 2018 or before, which don't address certain things like cost of living or any other changes to the programs themselves. So we all know costs are dramatically rising. They dramatically rose back in 2021, 22. And we also have aging clientele that need increased needs, which aren't being addressed. But those are rising costs. We are also seeing a higher demand in our programs. And we've more recently, probably in the last 6 or 8 years, been having to deal with wait lists, heavy volume. We have been an organization that has tried our hardest to never say no to anyone. We are saying no to funding and wait lists. Ultimately, we've kind of come at an impasse where either we get increased funding, either we can become sustainable, or we can no longer deliver programs, and we have to adjust our model and potentially fold as an organization. So that's our primary reason for being here. This came about from a letter on April 7th, which I believe everyone has seen. This was our primary ask, or our initial ask to say, please provide us with some attention, and more importantly, with better funding, more sustainable funding that addresses cost of living, other issues that we're facing. This letter had a few scenarios specific to our programs. Namely, it's our supported living program, which allows people to live in communities. It's our skills training program, which provides individuals with skills they need to lead meaningful lives and be part of the workforce. And also respite services, which allows caregivers, family caregivers, to lead meaningful lives and care for themselves as well. Since that letter, we've met with Minister Cleveland as Minister for Education and Employment, Culture and Employment. We've also met with members Robert Hawkins, Shanna Morgan, Julian Morse, Kate Reed, Kieran Tilster, Shane Thompson. More recently, we've met with the Senior Advisor for NGO Relations at the EIA, or Executive and Interdistrict Affairs, Catherine Robinson. And that brings us to today, meeting with everyone at this committee. Again, thank you for being with us. From here, I'd like to pass it on to Catherine Fairburn and talk about we are.
Go ahead, Catherine.
So you might know us under our previous name of Yellowknife Association for Community Living. We've been at the Abe Miller Building, which is also a term a lot of people know, or a gumboot rally. Those are some of the things that I think longtime Yellowknifers recognize about us. We've been providing lifelong support for individuals with intellectual disabilities and their families since 1962. We are a nonprofit, and most of our programs meet government mandates and keep Northerners living safely in the North and connected to their families and communities. I'm going to immediately hand it over actually to Lynn just for a brief description of each of our programs so you understand a little bit more about what we're talking about.
Yes, please. Okay, thank you. So our supported living program is, I think, one of the best in Canada. We operate on the roommate model. Clients get to choose who they live with, and they get to choose where they want to live within the Yellowknife community. Our clients are all from different communities in the Northwest Territories, from Tuktoyaktuk to Delaunay, Norman Wells, Port Providence, Spectacle, Lutsekay, and Yellowknife. We've been really lucky for the past 4 years. We've been able to rent with private landlords, which gives us more opportunity for clients to get out of apartment buildings downtown, live in trailers, townhouses, condos, and we're seeing that their life is more enhanced with the different living environment. Our clients pay taxes, they vote, and they have paid employment. You may have hired them through our famous odd job squad to do work at your home. And also we have 62 business services contracts, and that's the skills training and supported employment program. That group does volunteer for seniors. We have 23 seniors that we support in their own homes. We help them with lawn maintenance, snow shoveling, recycling pickup, and that allows that senior to stay in their own home rather than having to move. Our clients are fantastic tenants. They don't use drugs. They don't use alcohol. If anything's broken, we fix it. So they're great neighbors, and they're also great tenants for our landlords. They are the most vulnerable people in Yellowknife. Without our supports offered to them through inclusion, they could be homeless, hospitalized, and sadly even dead. Our clients enhance any workplace, neighborhood, and job placement. They also enhance all of our lives with their commitment, courage, and positive outlook to life. I think that's all for me there, Catherine.
And thank you, Madam Chair. If I can continue?
Yes, please, go ahead.
I think I'll just emphasize that we support about 60 different clients across the programs that Lynn mentioned, and that involves about 115 staff. Those numbers do fluctuate because month to month things do change, but that's typically about how many clients and staff we support. Lynn mentioned the businesses and the seniors who we support. Our clients are paid, for example, for the work that they do shoveling for seniors, but it is a service that we offer the seniors for free because we believe it helps people stay in their homes for longer. And then the one thing that I can't put a number on for you, but I really wanted to emphasize for the committee to be aware of, is that all of these supports also allow the family members of our clients, the loved ones of our clients, to do other things with their lives, to participate in the wage economy for many people, rather than staying home to take care of their family member. And that's, we believe, a significant impact on Yellowknife's economy and on the people here and on the way people can live their lives, although it's a harder one to quantify since it's about indirect family members. On to the next slide. I won't go through this in detail, but we have been facing a lot of challenges, many things that Ben already alluded to that our letter talked about. And one of the things that we decided to do was last year we received some NGO stabilization funding, and we used that to hire Janet Toner to do an independent review of our finances and our programs to kind of look at the overall situation and provide us that independent outside view. And with that, I will hand it over to Janet to describe her results.
Good, Jen.
Thank you, Madam Chair. So just to introduce myself, I'm Janet Toner. I'm an independent accountant based here in Yellowknife. I'm a former owner of Chroma Guide here in Yellowknife, and I was contracted back in the fall of 2025 to do an operational review of the organization. So what I did in terms of my scope of operation was I looked at 5 years of past operation, looked at all the contribution agreements for the past 5 years, and then just due to some concerns regarding funding, I opened that up to the past 10 years. So went back 10 years and then used that as my basis for my evaluation. So the first thing, just in terms of the organization as a whole, from an accounting and financial perspective, the organization, what one would look at to sort of see if they are in good standing and good health. You look at surplus position, cash position, working capital ratio, and reserve health. So the initial assessment of the organization, including NWT, is that it has a strong cash position, has a strong working capital position, and good surplus, being both operating and accumulated surplus. So it is a well-established, well-organized, well-governed organization. It is long-serving in the NWT, and it's also a registered charity in Canada, and it's in good standing with the Canada Revenue Agency Charity Directorate. So that's great for this organization, and probably why it's been kind of missed in terms of some funding opportunity, because it is in such good standing with the funding agency and with the government of Canada from the CRA perspective. So just looking at specific programs, once I sort of took a look at the organization as a whole, then I started looking at each of the type of programs that were operated in the organization. So the first program, supported living services program, and as Lynn has described, it is a 24-hour, 7-day care facility program. Currently, at the time when I was looking at the operations, 15 clients were being served under this program, 3 from Nunavut. So that was their client base. And as of December 2026, there was 7 people on the waiting list. So in terms of the funding comes from the GNWT and is expected to expire in July 2027. Base funding has not changed since the fiscal year 2018-2019. The same amount of money. They did receive a top-up to have 2 additional clients for that a short period of time, but that was specific funding for those 2 individuals. So again, funding has not increased since the 2018-2019 fiscal period. In terms of funding issues, it's been, as I say, that same level of funding since the 2018 fiscal year, except for those 2 clients that received specific funding. So one of the tests that I did is that I applied sort of a CPI analysis. I went back using the CPI for Yellowknife NWT and extrapolated what that funding would be if it was funding based upon CPI. And that came out to 2.4 million if they used CPI as an index for funding for each year. Then I looked in terms of the future, what it would look like if that still same level of funding existed for the next few years, and determined that with increased expenses due to inflation and increased costs, and the funding remains the same, that they're going to anticipate a deficit for the next few years in this program. And just as an interesting comparative with this specific program is that there's 3 clients that are being funded by the government of Nunavut. And so this gave me the opportunity to compare the funding from government in Nunavut compared to the government in Northwest Territories. And two kind of things were highlighted. The first one is government in Nunavut funds their clients a lot more than the government in Northwest Territories. And if that same funding was applied to the 15 clients of the GNWT versus the government in Nunavut, GNWT should have increased their funding by at least 772. And then specifically, the government of Nunavut funds per client, and they fund based on the specific client. So depending on if a client needs higher needs, there is more funding opportunity. So as shown on the screen here, GNWT client is funded at 194, a GNU client is funded at 271, and then a GNU client with higher needs is 373. So again, just having that government of Nunavut clients, there's 3 clients in the organization, gave me that ability to provide a comparative. So the next program that is funded by the GNWT, or it has some assistance from GNWT, is the Skills Training and Supported Employment Program that Lynn talked about. This provides job training and employment opportunities for clients. It runs during the day, and it gives clients a variety of different employment opportunities, such as what Lynn described, snow shoveling, paper shredding, and other activities. So the goal of this program is for the clients to be involved in a variety of different jobs and engaged in the community. So in terms of the program issues, 23 clients were currently in the program when I looked at it in December 2025, and 4 on the wait list. They did face a lot of internal issues in terms of their operations in a COVID environment, since most of their activity involved going into client operations and doing paper shredding. So they had to kind of pivot a bit and look at different operational activities, which they did successfully. They do receive some government funding support, some supplemental funding, and that funding has only increased by 11,000 since 2023. So it's been pretty steady at the 501,000 for many years, with that slight increase of 11,000. The next program is the respite program. This provides services for family caregivers, and the hours can vary from 2 to 5 depending on the needs of the family. When I looked at the program itself back in December, there were 26 families on this list and 16 families on the wait list. Currently, just talking to the manager, there's 40 families that are receiving support now because of additional funding that was offered, I believe one-time funding, and 35 families are on the wait list as of this month. So the funding is provided by the GNWT, and there was a 1-year increase in funding for this program. So the funding issues with this specific program, this respite program, is that there's a large wait list, and they cannot serve all the families on the wait list. And even if they look at internal resources in terms of trying to allocate hours per family, there just isn't enough internal resources to assist the current families that are being provided service, plus the families on the wait list. Is just not possible. So there's a desperate need for additional funding for this program to help the families that need some respite support. Just sort of wrapping up, the NWT inclusion NWT, sorry, called the other name, is a well-established organization with strong governance and operations. It has a strong financial position, as it's well recognized as a strong not-for-profit in the North, plus it is in good standing with the Charity Directorate in Ottawa and Canada Revenue Agency. There is an increased need for funding. There is an aging population, and large communities are not being served. Funding hasn't changed; it's unchanged despite raising operational costs. Demand's going to, as you know, given by the waitlist, has increased, and in anticipating future inflation. So there is an increased need for funding to be increased in order for them to maintain their current level, and then to also assist with the clients, potential clients on the wait list. So in order to meet the community needs and ensure their long-term sustainability, increased funding is needed.
Thank you. Thank you for the presentation.
I'd actually like to pass it back to Catherine, if you don't mind.
Oh, yes, Catherine.
Sorry. Thank you very much, Madam Chair. We just have a little bit more. I know we're running to the end of our time. We just wanted to be really clear what we're asking for now, based on some of the information that was just presented. Our April 7th letter included 5 main requests, and based on some of our engagements with MLAs and others, we've narrowed that down to what we really think we need now to continue operating. And the biggest issue is our supported living program, because it's the most expensive program. That's the one that Janet was talking about, where if you considered inflation, that 1.9 million should have grown to at least 2.4 million. Or if you consider how much the government of Nunavut funds their clients, our funding would be over 700,000 more a year. So that's where we're actually operating that program internally at a loss. We're subsidizing that program with other funds that we have, other donations, and so on. And that's not sustainable for us. And so that's our biggest ask at the moment. So the first one is mending that supported living funding gap, increasing that amount. And we will be providing a follow-up letter with a specific amount that we're asking for here. But that would help us make this program sustainable and allow us to use that other funding that we're, other donations and so on that we're currently subsidizing this program with. We can instead use that money to enhance our programs and potentially hire staff that would help us keep things running smoothly within the organization and so on. So that's one of the biggest main asks. The next part of that is about level of care. And level of care, Janet talked about it a bit. A lot of our clients are aging. Over 40% of our clients are over 50, and funding isn't tied to the actual level of care that they need. And that's been very challenging for a variety of reasons. People's needs change over time, especially when you can think about, like, a really easy example is physical illness. If clients have to head to Edmonton for care, for medical treatment, they need support on that journey. And that means that we're sending potentially staff one-on-one with that client to Edmonton. And right now, that's a cost that we just need to manage. There's no way to discuss that change of care with our funders. And we have clients, as Janet pointed out, with the government of Nunavut, and we deal with this level of care approach, and it works much better. If a client's needs change significantly, for the better or for the worse, we can work with the funders to adjust the funding. Oh, and that's my timer that I set too loud, sorry. That our time's up. Apologies. I'll move on to the very last one, just 30 seconds. The other thing that we didn't want to lose from our initial asks was about wait lists. So we have wait lists across all of our programs. And although I know that this is a longer term request as well, what we're asking for the government right now is a commitment to sort of look into this. Like the supported living program, the first 2 requests are our main thing that we need to keep things moving, but the wait lists are also really important. They affect our clients' well-being and their families' well-being, and we'd really like to see some movement on that in the long term. Know that there's a plan in place to help address the wait list, so we can start telling families that there's some hope that they might eventually move off of the wait list. And with that, I'll hand it back to Ben if we have a few moments.
This is our last slide. Thank you. So what this all means is if we can't secure the funding that we need, if we can't deliver the programs that we need to deliver in this community with adequate funding, there's a community impact. Many employees will lose their jobs. Families will lose the supports they need and probably have to leave the workforce and seek other supports just to continue caregiving. There's just going to be overall pressures on our health systems, our social systems, housing systems. Every facet of government will be impacted. And ultimately, GNWT will have to deliver these programs somehow else, either through themselves or finding another provider. I kind of hinted at the beginning that if we cannot sustain these programs ourselves, we are now looking at the inevitable of folding, not delivering these programs because we're simply unable to. So with that, thank you, and I'll give it back to you, Chair.
Okay, thank you. So committee, do you have any questions for this today, starting with MLA Morse?
Thank you, Madam Chair. My first question is just one, just looking for a bit of clarity in on the slide that speaks about the wait lists. It talks about the supported living wait list, the skills training wait list, and the respite wait list. Are those programs, like, is the way that Inclusion NWT is funded, is it through that one funding agreement with the GNWT, or are these all programs that are individually funded by different pots of funding? Can you help us just understand that a bit better?
Yeah. Joe and
Ben,
Ben, Mr.
I'd like to pass this to my executive director, Lynn.
Yes, Len. Yes, go ahead.
The supported living contract is with NTHSSA. It's a contract, and so we bid on it with a request for proposal. Sometimes it's 5 years for the request for proposal. This time it was only 3 years that we won. So that amount of money is for that program. Skills training supported employment, we get the just over $500,000 from NTHSSA.
Okay.
We also get 2 pots of money from BCE, which is 220.
Okay.
So that is for that program as well as our employability program. Respite program, and that's a contribution agreement. Respite is another contribution agreement. Every year we do a proposal, every year we fight for what money we want. And that's also through NTHSSA.
Mr. Morse, MLA Morse, do you have a follow-up question?
Yeah, at least one. Thank you, Madam Chair. So, yeah, I'm just trying to kind of, so there's a couple of different pots of funding. So you're asking for us to mend the supported living funding gap specifically, but I understand, or maybe you can help me understand, committing to the level of care funding model. So that's the funding model that NWT's using. Would that help to mend the supported living funding gap, or are they separate issues? I'm just trying to understand these various different pots of funding, how they work with what we're trying to fix, and just making sure I'm being specific enough about what it is we kind of bring back to the government in terms of wanting to fix it. So the level of care funding model, as I understand, is how NWT's doing it. And yeah, I just want to confirm that switching to that model, doing things the way NWT does, would help with the supported living funding gap, or are they separate issues?
Mr. Russo? Yes,
I'm sure. So there's 2 issues at play here. One is we're not operating at today's dollars. We're operating at 2018 dollars, even earlier.
Yeah.
So we're asking to be updated to that. From there, we're also asking to address these contribution agreements at an individual level.
Okay.
Meaning if someone does need heightened care or if someone needs less care, we can accommodate and kind of address what they need at the individual level, and put that into a common agreement just to make sure that we're getting the funding we need. Yeah.
Okay.
Thank you. Thank you.
Madam Chair.
Okay, yes,
Catherine.
Catherine, yes, please, go ahead.
What Ben said. Everything Ben said is accurate. The other thing I wanted to add was the timing issue potentially. I think it's possible. We've asked the government to implement or commit to the level of care funding model for the next cycle, which would start hopefully in July 2027. But if that does take longer, for some reason, to implement that, to figure that out, we've occasionally had our existing agreements extended for a year or 2 before they put out a new request for proposal. We need that funding gap mended in the meantime. So that's a little bit of why they're separate. In theory, the level of care model should also address the funding gap. You're right. But in case that timing doesn't quite work out, we want to make sure that the funding gap is addressed as well.
Okay, thank you. MLA Hawkins?
Yeah. Thanks, Madam Chair. First of all, I want to say thanks for the presentation. It's one of the better ones we've seen. Furthermore, it's nice to see someone really worry about timelines and efficiency. So kudos to those who've put so much work in, and we tend to forget that when things look easy, we always glaze over and forget about how much work it went in to make sure that it's a good, clear, succinct presentation that really hits home. So I want to point out that I see a lot of work to get you here, and I want to make sure it's recognized because it is high quality. It's a high quality presentation. So specific, Madam Chair, I want to point out, I fully agree with the Society's request. I think that Inclusion NWT has been doing work well beyond what they're being supported with financially, that is. And I think that the request is fair and reasonable. I'm not going to give them a specific question per se, but I just want to provide a brief comment furthermore on this. But I met with them, and thank you for highlighting that. Many of us support the services that you provide. And I think without what you do for the community and for the individuals in your care, we would be struggling with an answer of what would be considered adequate or reasonable. And hence we're grateful. Like, I'm grateful for the cornerstone services you folks deliver on. I have, as mentioned, and I did say I would at our meeting bring it to the Government Operations Committee, although this isn't that committee here today. We're discussing and struggling and seeing what we can do on that side from a overall structural point of view from a finance challenge, but from a social side, specifically to your program, I think we should all recognize and be grateful for the work you do. And I think you're comparable to Nunavut is a fair and reasonable request. And I hope the committee finds a way to get behind this and support that need, because again, without you, I don't know what we would really do at the end of the day. So thank you very much for your service to our community. It is incredible. Thank you.
Thank you. Thank you for the comment. Do you want to reply?
Just a very sincere thank you for paying attention to us and to allowing us to be here today.
Yeah. Okay, thank you. Ms. MLA Morgan.
Thank you, Madam Chair. And thanks to all of you too for all the time you put into this and for being here today. I wanted to first ask for clarification. You showed the contrast between how the government of Nunavut funds per client. So I just wanted to clarify that. Can you confirm that the NWT does not fund you per client, let alone per service level, or do they have a certain amount of funding per client, or do they just give you sort of a block amount and say, however many people you manage to serve with that amount, great, whatever happens. And I guess both for the supported living side and for respite, do they have some sort of calculation already per client, or are they just, this is what we've always given you, support however many people you can take that?
Mr. Russell?
Again, pass that to my executive director.
Yes. Ms. McKinnon? Please.
So the supported living contract was block funding for 12 people. So this is the money for the 12 people. Respite, it's again a contribution agreement, and it is block funding. And we make it work for them. There is an assessment that is done for anybody who is wanting respite. We support children as young as 3 and also seniors for that program. It's mostly children. And so there is an assessment completed on each person who's interested. And then there's levels within that. So some people might get 5 hours a week. Some people might be eligible for 15 hours a week because of the parents.
Okay. Thank you. MLA Morgan, do you have a follow-up question?
Thanks for clarifying that. And so, I mean, maybe I'll sort of skip to the end question and then work back if there's more details. But I know you have met with GNWT staff who are supposed to be working closely with NGOs to make sure that there is that appropriate coordination and levels of funding. And so can you give us any information on what the response was? Is the GNWT acknowledging that there's currently not adequate funding, or are they acknowledging what the consequence would be if you had to cut down on the number of clients you could serve? What would happen to those people? How they would probably need to be, in some cases, served out of territory, and what the additional costs would be? Like, is that all being acknowledged, or what kind of responses are you getting from GNWT when you're meeting with them?
Ms. Foley. Oh. Yes, good. I would say that we are not getting the support that we would like. We're not having the conversations that we would like to have. I'm not going to say that we're being ignored, but I think that there's so many challenges within that system already, that we're not able to kind of find out who we can meet with, who we can talk to. That's all I have to say about that.
Okay, thank you. Now I'll go to MLA Nelson. MLA Nelson, you have a question?
Yes, first of all, I'd just like to thank you for your presentation. It's very informative, and I support any and all requests that you've made. I'm not very very informative about your organization, but it sounds like a very good organization that's helping not only the community of Yellowknife, but the residents throughout the NWT. You know, I've have a lot of requests from the residents of my riding, and I go directly to the departments, and with your legal advisor, I think maybe some of these questions can be related or directed to your programs, and maybe we can get some answers. So, you know, I have some people that live in other jurisdictions and are requesting assistance in trying to relocate them back to the NWT or support their families when they're in another jurisdiction. And it's very, very difficult for myself to give the answer that I get most of the time. It's a negative response from the department. So I am in support of your request, and hopefully our committee can come to terms and have a supportive letter and relay to the department of that you're requesting it from Mr. Cleveland and her department and other departments. So I just wanted to make that clear that, you know, I am in support of your request, and hopefully in the near future I will be probably in contact with your department to see if my request can be related to anything that your programs may be related to. So just like to thank you on that. Thank you.
Thank you. MLA to start. You have a question?
A stream of comments. I thank you very much for the very thorough presentation. It is very important work you do in our community. I know I have a number of constituents who make use of your services or who are on the wait list. So it is definitely in the interest of Yellowknifers and I think all people in the Northwest Territories to see more support for the work you do. I think this is an issue that many non-government service providers are experiencing, where funding agreements have not adjusted to keep pace with the cost of inflation, which I think we can all appreciate is very high and has only been increasing since the the pandemic, and shows no signs of decreasing with global instability adding to those costs. So I'm very supportive of this. I think if the government of Nunavut can do this more equitably and support people who need supportive living services, there's no reason why we can't. And I'm dismayed to hear that your discussions with the government have not borne fruit, because often we hear that our colleagues, our cabinet colleagues, are very supportive of these issues, but when it comes down to it, we need the money, not just words of support. So we will do, I think, sounds like my colleagues are on side, but we will do whatever we can to ensure the policy changes come in place that provide more financial support for the work you do in our communities, and you have my full support. Thank you very much.
Thank you. MLA McNeely.
Yes, good morning. Thanks for the presentation. I see a lot of value in your services to the general public, and I too will be supporting our committee position to show the support where needed, either through CPI index of your 2018 dollars here, and also broadening the contributions for continued services in those areas. So in closing, I just want to thank you, and I'm willing to help any way possible. Thank you.
Yeah, thank you. I do have a question too as well. Okay, so inclusion NWT. So I just wanted to know if the organization is working with other communities to create this kind of program in small communities. Thank you so much.
I'm going to bring up the list here. So we are a grassroots organization. We've started as being advocates for inclusive individuals having inclusive lives in their communities. Due to infrastructure, we are based in Yellowknife, and we provide our services in Yellowknife. But we do support people from Litsoke, Tatayaktuk, Delaney, Betchego, Norman Wells. We support them here. We also support remotely if individuals in other communities, individuals and organizations in other communities they support, they reach out to us and we help them. Ultimately, what we'd like to do is see people supported in their communities. And that's kind of our trajectory for advocating is having that. What we need to deal with now is dealing with the funding shortages to support individuals here, and then allowing us with our own money to go and make these advocacy initiatives happen.
Okay, because well, inclusion in WT. So because I'm one of the MLAs that's really supportive and advocating for this kind of program in my region. According to the minister, when I asked her the last time, there are about 12 of the individual citizens outside of the NWT. They're being looked after, and even in my communities, people living with challenges are increasing. There's great need for it, and now with aging parents in a senior home. Some of these young people that have been living with their parents for forever since they were born are being cared for by other relatives now, and it's not the same. We know that it's likely well going to be the same how they spend time with their parents, and many of our people living with challenges are fluent speaker in Quechua language. So when they go to Yellowknife or somewhere else, it's going to be a challenge for them. And I think, and then some people living with challenges in my region, there are some that are really well looked after. They're loved. The family are really taking extra care. But there are some that are neglected, really heartbreaking, that are neglected. And some of them, they're forgotten, and that they have an addiction issue. So those are the reason why I know that a lot of my constituents have said the same thing too, where we need an Abe Miller Center. We need that kind of a facility. We need a supported living program for our citizens that are living in our communities. And I see that you have a lot of people on the wait list. So I just want, to ask, because I've done quite a few members statement on it. If the inclusion NWT have reached out to other communities to see if they can help support them with the program, with the program and services provided that you guys provide. I just wanted to know if you guys reach out because I haven't heard anything. And even our chiefs are saying the same thing. We need a program here to keep our people here instead of being sent to other jurisdictions. Like most of them are in Alberta, in a group home. And it's sad because, like the only time that they bring them back is when they are really sick and they put them at the stent. And we shouldn't have to be, they should be at home. That's what we're saying. So, so that's why I'm just asking, have you ever reached out to other regions where, like Pichico or like Teacher Region or to Teacher Government that we do need support? Have you ever reached out to them? Inclusion NWT.
I'd like to
Thank you.
pass that to my executive director, Lynn Foley, but before I do that, I do want to comment, what we're trying to do today and forever is we're combating that answer to every problem of, can you just send that WhatsApp? And our answer is no. We do not want to, we will not support that ever. We want people in their communities living inclusive lives in their communities. That's exactly what we do, and that's why we're here. But I can pass it to Lynn for some details.
Okay, Ms. Foley.
So I've had some conversations over the past 4 years as ED. I was also an adult services case manager for over 20 years through the government, and involved with some transferring of folks, going to Alberta for support. Our challenge is a financial challenge. And I think that every community, if they had an Abe Miller Center and a supported living program, would be fabulous. A lot of our clients have been in Yellowknife for over 30 years, some through the foster care system, and then they've stayed and been supported by us. I do think it's a really big problem. Most of our clients are Indigenous, and a lot of our staff are not, and are not speakers. So I do think it's a bigger issue for the health authority to look at, and I think it's really important.
Okay, Ms. Fairbrother.
Thank you very much. I just wanted to build on what Ben and Lyd said there. I guess first, one of the reasons so there was a bigger push at a national level for associations for community living to shift to inclusion. But one of the reasons we shifted our name from Yellowknife Association for community living to Inclusion NWT was because of seeing the need to expand beyond Yellowknife's boundaries. And we do get phone calls and try to provide that kind of support. But yes, due to financial constraints, we haven't been able to go beyond that. But that is one of our goals. And it's symbolic, but that was one of the reasons we changed our name to Inclusion NWT, was because we want to make that shift happen. The other thing I just wanted to add is that those waitlist numbers are, they're accurate as far as we're aware, but they're also potentially misleading in that they don't represent the real need. We haven't, because we don't have the money, we haven't gone out and beaten the bushes for everybody who might want these programs, who might want to sign people up. So, there's 7 people on the supported living waitlist, or at least there was last time we were aware of the number. That's now information that's with the Department of Health and Social Services. But those 7 individuals are just the 7 people whose families know about our program and have chosen to add them to the waitlist. We know anecdotally through things like what committee members have said today, that there's a much higher demand than that out there. That there are clients, as you pointed out, that are already down south that really, we would like to see them supported at home in the Northwest Territories. And so I just wanted to flag that for the committee members, that those wait lists are probably they would be much bigger if more outreach happened. We've talked about whether we should do some of that additional outreach to show the real demand in the community. And one of the challenges that we're facing is that we don't want to mislead families either, right? We don't want to go and beat the bushes and add 30 families to our wait list, knowing that there hasn't been movement on our wait list for a long time. So yes, as Ben pointed out, we're trying to sort of get this initial funding in order first, sort of make the program sustainable. And then we're hoping to continue our advocacy work to get more people into the program, to potentially expand, it would be amazing if we could bring people back to the north who've been sent south, because that was the easier option. We would be interested in supporting all of that work.
Okay, thank you. And Elaine Wars, do you have a question?
Yeah, thank you. just speaking to the wider issue, this is something that before inclusion NWT came presented to us, I've had different constituents come to me and I've advocated for in the past. And something that's been highlighted to me is that well, anyways, just to get to the question. In response to my questions on this issue, the health department has said to me that there is not a lot of potential for keeping more people in the NWT if we were to provide more funding to respite care or supported living supports. Just saying that most of the people who are from the NWT end up down south because we are unable to provide the level of care that they need. But I'm curious to unpack that a bit with your organization. I mean, do you agree with that assertion, or do you feel that there is more capacity to have people stay home and not be institutionalized down south if your organization had better resources? I hope that question's clear. Sorry, I was realizing that I didn't have a background to give there, but
right now, we've supported individuals who have had increasing health needs. One of the gentlemen for NWT has to do dialysis 3 times a week. We've never done that before. So we were educated by the hospital. We're not nurses. They're not nurses in people's homes. So the staff and the clients were all educated on what to do. So we've been successful for almost 2.5 years now with good health for him. So I think we can support anyone if we have the right support. Sometimes the challenge is an accessible home. We've got some accessible condos and some condominiums that we're renting. So there are the ability to have accessible homes. Our clients and families do not want group living anymore. They want to live with a friend. They want to choose who they want to live with. They don't want to live with 5 or 6 people. And sometimes on the weekend with one staff, nobody gets to go out anywhere. That's not a normal transition for an adult when they're in the community. So I think that we can support anyone in Yellowknife and in any other smaller community if the desire is there for these individuals. If desire is to ignore them and have everybody go to Alberta in group homes with 5 or 6 or 8 people, and maybe you get 1 trip a year, it's not fair. It's not fair to those individuals. And in the days of residential school and institutionalized living, where many of these clients ended up, we don't want to keep seeing this cycle go over and over again. And so it isn't true. I think we can support anyone with amount of funding. We have a great staffing team, many over 10 years that have worked for us, who have been trained, supported, and are committed. So we can get bigger and bigger and bigger and go all over the place if we can get that support.
Natalie, do you have a follow-up question?
Thanks, Madam Chair. Yeah, no, I think that this is one of the difficulties I've had in advocating for this issue is just, I don't have the expertise to respond to assertions like that from the department. So it's helpful to speak to your organization as well. And I just think that the thing is, I mean, if the GNWT is spending money to support people either way, I think there's a massive advantage to having that money spent in the territory and having those people stay in the territory for a few different reasons. There's good moral reasons for that to happen, which I think is first and foremost, but it's also, I think, better for the NWT generally to not have money flowing out of the territory as well as losing residents that we'd rather have here, that I think families would rather have here. People will want to stay in the NWT if their families feel supported. So I guess that's not really a question so much as just saying, similar to some other MLAs who've already spoken, I do really support the issues that Inclusion NWT is bringing forward to us. And I, of course, support the work that your organization has been doing for decades. And like my colleagues, I have many constituents who benefit from the work that Inclusion NWT does. And furthermore, I have a number of constituents whose family members are either down south because we don't have enough resources here, or are considering moving south or have moved south because we don't have the supports here. And I don't want to see that happening in the territory. And I know that this is an issue for people either who have family members who need the services that Inclusion NWT supports, but also others. I mean, I've heard from constituents who don't have a disabled family member just saying to me, like, we don't want to be losing population in the NWT. We want to keep people here. We want people to feel supported here. That's how you have, a vibrant territory is supporting people and ensuring to keep them here. So I guess that doesn't really counter the question, but happy to hear your feedback if you have it.
Okay, we'll go to Ms. Fairbairn. Sorry about that, your last name. So do you want to answer the questions?
Yes. I was just wanting to build on Lynn's answer. Just thinking to your point, Julian, about how to respond to those concerns. I agree with Lynn. The one aspect of it that I would flag is that in addition to the funding resources, the other potential challenge that maybe is what they're describing is staffing. And so I do think that we could support a variety of people. My sister isn't in the north, but she's in Saskatoon, and she's the highest care level sort of needed as an individual, and we found a wonderful setup that works for her. But if she was from the north, I'd want her to stay in the north, potentially, closer to family and so on. And I think we could even support people with her very high level of needs in the Northwest Territories. The one thing that I'm trying to, I guess, flag is that in addition to having the money to do so, we also need to be able to find the staff to do so if the needs are very high. And so that is one thing that we'd have to consider, is that it wouldn't be an instant change. As people's needs grow, we need more potential personal care. Sometimes you need actual nurses or not, maybe not nurses, or what, anyway, there's different care needs. You need people with certain qualifications to give medication and so on. So there is a point where it is still about funding, but it's also about finding the right staff. But I don't think that we're even at that conversation level yet. Like right now, we're still at the conversation of just supporting people with similar needs to our current clients, maybe a little bit higher needs than our current clients. Long term, I think we could support almost anyone in the north if we had the right resources.
Okay. Thank you. So we'll go to MLA McNeely. MLA McNeely, do you have a question?
Thanks, Madam Chair. Mine is more of a comment here. I like what I'm hearing, and just to add on to my my further announcement is really about designing what committee's response or work plan to engage in increased funding to provide these services. If we can demonstrate in our designed response or campaign plan for more funding, would be to show, and with the help of your information from your organization to provide that information, how can we demonstrate and design a response for increased funding and show to the JNWT, okay, we're going to save you cost as a provider for training. This is what you're doing. This is what we are doing. And there's other organizations and NGOs out there doing the same thing. So there's multiple targets or aggression plans for the same points of increased demand for skills training. So, I look forward to gathering your outcomes, what you've done so far. Maybe you can provide a profile of candidates that have succeeded your programs over the last 24 months or 36 months. That'll help committee design a campaign funding increase plan. Thank you.
Thank you, Mr. Russo.
Madam Chair. One of the core things that we're trying to address here is we're asking the GNWT to honor finance policies that we've had in place since 2014 and even sooner or earlier, namely to address cost of living increases as part of ongoing contract negotiations or contribution agreements. I think MLA Morse addressed this back in 2024 at the table. And I think we've talked with the Minister of Finance on this as well. There was a recent report from 2026 replacing another report from 2024, and in those reports and in other policies, it is suggested and kind of directed that people engaged with contract negotiations, contribution agreements include increases as part of their annual assessments. So that's possibly the core thing is we're just asking GNWT to honor that and to allow those cost of living increases to exist. And then from there, we'd like to build new models and figure out how else we can work towards what we need to have sustainable programs.
Okay. Mr. McLean, do you have a follow-up? Emily Morgan, do you have a question?
Yeah, thank you, Madam Chair. It does seem that a big part of the problem here is that the government has been funding this as if it's just a nice to have extra thing that, you know, any money, you know, you should be kind of grateful for that we can give to NGOs to do these nice things, but that it's somehow not part of the core work of government. But I think it is clear that what the services you're providing are things that are part of our core responsibility to, you know, offer in society and do fit with the government's own mandate of what the government wants to be done. And so what's frustrating for me too is that we don't seem to have an overall assessment of the total need and have budgeted. The government hasn't sort of looked at the need, the demand, and set aside the amount of money that's actually required to meet the need. Seems so simple, but as with many things, this is just sort of whatever extra money we have, we'll throw your way, but we haven't budgeted to meet the need. Now, I have reviewed the supportive living review that came out in 2023, and I know that that's not exactly the same as what your organization does. I mean, it covers some of what you do with supportive living, and then there's other kinds of supportive living too that the review covers. But one thing that sticks out from that review, they say that 68% of all the clients needing supportive living are currently out of territory. So while it's unclear to me whether we even have full data on what the need is, what the demand is. Like you're saying, waiting lists might not cover the actual demand. So we do have some numbers to show that, the best, 2/3 of people currently we're just sending out of territory. But I don't actually see a full costing even in that review, because there's mention of, okay, ideally, the goal and the recommendation is to bring more people back into the territory. Great, but what would that actually cost? What money would we have to set aside? What would that look like? So my question for you, I guess, is, do you see any movement with the supportive living review towards the government trying to get a full handle on the need and actually cost this out? And have you been part of the processes around the supportive living review, or do you see the GMT as far as they ever have been from recognizing that this is a core need, this is a basic fundamental social service we need to be offering, and we need to cost it out and set aside money accordingly?
Thank you. Mr. Russo.
I'd like to pass this one to Nicole.
Ms. Paul.
I was involved in some of the meetings with the review. There's sort of a whole group that was involved in looking at what they were doing and maybe giving some advice and different things. I always feel like we're kind of the invisible people, right? Our clients are people that, are allowed and march around. They're kind of forgotten, and I sometimes feel they're not important. I know that the health authority has a lot of stuff going on, but our clients are just as important. And so I get frustrated with the lack of communication and not having somebody at the table who's listening to us and wants us. We just plod along, do what we're doing. We care about the clients. We want to keep the contracts and contribution agreements, but we're now seeing such a great need, not only in Delnick, but in the smaller communities. But yeah, it's a little frustrating. That's why we're here today. That's why we've all worked really, really hard to get our voices out to make lots of people, but there's not the people that we really need to talk to that are necessarily at the table.
Mr. Russo.
Just wanted to add, we often have direct contacts with some of our programs. So then we'll speak to people directly in government to arrange and coordinate what these programs look like. But there's quite often and kind of routine the left hand, right hand situation, where left hand is the support, caregiver or support worker who is invested, who understands who our clients are, who understands what we're trying to do. And then there's the right hand, the finance side, where suddenly it's just a yes or no, and usually a no to whatever has been discussed. So there's a very big disconnect between what the government knows or what we think they know about what we're providing, who we're providing it to, how much it's costing, how much we need to make it work, and the actual people making the decisions about the funding. And so I think there's a major disconnect that needs to be addressed there.
Okay, Emily Morgan, do you have a follow-up? No? Okay. If there's no more other questions, I want to say thank you to Inclusion NWT for appearing before us. So this concludes our public briefing. Thank you.
Very much.